All right, we know that people visit emergency departments for a number of reasons, but there are a few more common causes for trips to see emergency physicians, especially for children. If you've never been to an ER before, you might not know what to expect. You're probably a little nervous about it, especially if you're a parent, you have to take a kid there.
Absolutely. Dr. Anupam Kharbanda is with us from Children's Minnesota, filling in for Dr. Gigi. I think we've had to go to the emergency room once or twice with our kids, and it is terrifying and overwhelming. I'm sure it would help to have a little bit of preparation.
Absolutely. I mean, for many parents, children are their most precious thing, and to see them not feeling well or in harm, they obviously are very concerned.
What are the most common reasons that people come? Is there a kind of seasonal cycle as to why people come to you?
There is. We tend to see more illnesses depending upon either the temperature, the weather. For example, now with the temperatures dropping, we can see more asthma-like symptoms. In the spring, we tend to see more dehydration and GI bugs.
Okay,
but the most common reasons, honestly, are things such as fever, belly pain, and ingestions and injuries.
Sure.
For parents, what are the things you should look for? Now's the time to take your kid to the emergency room.
I think there's some key diagnoses to think about or conditions. So if you have a fever in a child under 6 months, that's certainly a reason that you need to talk to your pediatrician and consider a trip to the ED to be seen, especially if that fever is persisting. Children who have persistent belly pain should be seen, and because that could be either they're getting dehydrated or could be appendicitis.
Sure.
Second thing.
Trouble breathing, you think?
Absolutely. If they're having difficulty breathing and they're not responding to their asthma medications, or they've never been diagnosed and they need some, that would be a third thing to think about.
We've seen a huge increase in all of our suburbs, especially in the cities as well, of urgent care locations. And I'll say, like, it's a gift when you can't get into your primary doctor. Something happens on the weekend or at night. What's the difference really between making an urgent care visit and going to an emergency department?
That's a really good question. And I think it comes down to two things. One is timing, and what time of day that you need to visit, and staffing. So emergency departments are always staffed by physicians. At Children's, we're staffed by people who are specially trained in pediatrics, and we also have a complement of subspecialists such as surgeons and GI doctors and orthopedic surgeons who are trained in that manner. They're also available 24 hours a day. Urgent cares have specific hours, and they're usually staffed by, especially if they're at an office location, by a nurse practitioner.
Which is fine, but it just depends what sort of what your needs might be.
Exactly. And then
often the urgent care will refer you to an emergency department.
Correct.
Right?
Urgent cares are really good for very specific complaints, earaches, throat pain, maybe a urinary tract infection. They really do a nice job with that. They're very convenient and they're cost effective.
Good. All right. Great tips. Yeah. It's nothing to be afraid of. You guys especially know how to deal with young people and parents.
We do. We try to do our best. So thank you.
Very good. All right, Dr. Anupam, thank you so much.